Good evening, ladies and gentlemen. Welcome to tonight's edition of HR Mentorships Learning Series. Please do me a favor, reach out to your friends, your colleagues, your associates, so that they can join this call live and get the benefit of this session and also get to ask any question they may have or around the subject matter. The topic we'll be looking at today, okay, is pre-employment, pre-placement, post-employment wellness guide for HR professionals, okay? Don't worry, all these simple concepts will be even made even more simpler as we progress into this meeting. Our facilitator for today is Dr. Yinka Adeniran. I'm reading his profile briefly so that those of us perhaps who do not know him will get to have an insight as to his background and why he's the one who is speaking to us today. All right, Dr. Adeyinka Adeniran bagged the Bachelor in Medicine and Surgery degree, okay, from the University of Ilorin, 2001, and then subsequently became an associate fellow, okay, of West African College of Physicians, all right, in 2008, and a fellow of the Nigerian Postgraduate Medical College in 2011. He also has a master's in public health from the University of Lagos, Nigeria, and a certificate course in healthcare financing from the Institute of Public Health, University of Edinburgh in Germany. Dr. Adeniran is the chairman of Petra Global Group, which has Shaw Diagnostics, Medibox Healthcare, and PG Consulting as member companies. He's also the founder of Better Health for Africa Initiative, okay, whose aim is to promote access to quality and affordable healthcare for all. Since 2012, he built Shaw Diagnostics from a small lab with less than 200,000 to a multi-million naira organization that it is today with multiple branches, both in Lagos and in Osun State. All right. Also, since 2010, Dr. Adeniran has provided health systems management advisory, okay, and strategic support to several organizations, all right, including Family Health International, Hope Worldwide, MTN Nigeria, GT Bank, Upanga Nigeria Limited, and Lagos State Government, not forgetting Kaduna State Government and Philip Consulting, among others. He is happily married and blessed with wonderful kids. Ladies and gentlemen, please, with our emoticons, let's show some love as I hand over control of this meeting to Dr. Adeyinka Adeniran. Over to you, sir.
Thank you so much, Mr. Yemi Adeosho, for this opportunity. And good evening, everyone. Thank you so much for joining. And this evening, we'll be looking at pre-employment, pre-placement, and post-employment wellness guide for HR professionals. I know as HR professionals, we are interested in our employees, in our workers. We're interested in their health because we know that without their health, you cannot get the best out of them. As a matter of fact, some people will tell you, HR experts will tell you that one of the most important assets when it comes to resources in any organization is human resource. That's the most important asset. And one of the most important assets for that resources is their health. And that's the reason why I think as a human resource expert, you have to be able to know how to manage the health of your workers so that you can get the best out of them. So this evening we'll be looking at this topic under the following outline. I'll do a brief introduction and historical perspective to pre-employment screening, and we'll discuss why pre-employment health screening is necessary. We'll discuss the legal perspective. We'll look at what pre-employment health screening entails. We'll look at how you can get the best out of your pre-employment health screening and then we conclude as appropriate. So what is pre-employment health screening? It's an assessment that we normally perform, when you want to engage your workers. So it's a kind of medical assessment to ensure that a prospective employee can perform his or her job safely without placing him or herself or co-workers or clients at risk. So it's a set of screening or medical tests or medical assessments that we normally conduct on employees so that we'll be able to know whether they can perform their job without placing themselves or their co-workers or their clients at risk. And it's a very, very important aspect of pre-engagement assessment. All right, so let's look at how it all started. The use of pre-employment health screening has a long history dating back to the late 19th and early 20th century. So at that time, employers were starting to realize the importance of ensuring that new hires were physically fit for the demand of their jobs. And in the later half of 20th century, the focus of pre-employment health screening now shifted towards drug testing as concerns about drug use in the workplace grew. In the late 1980s and early 90s, drug testing became more widespread and many companies began to implement pre-employment drug testing in addition to other medical screening as a condition for employment. So it's something that started 19th century and then is now popularized in the 20th century. Now let's look at a case study as to, So let's look at a case study as to why pre-employment screening is very, very important. So I'm looking at a case study of Johnson & Johnson. Over the years, pre-employment medical screening has often been viewed as a nice extra and not a strategic imperative. However, newer evidences tell a different story. According to the Harvard Business School review, since 1995, the percentage of Johnson & Johnson employees who have high blood pressure has declined by virtue of their wellness program in the workplace. And by more than half, I mean, when they checked employees with high blood pressure, just looking at one indicator, which is high blood pressure, they discovered that a high percentage of Johnson & Johnson employees who have high blood pressure has declined, but by more than half. This remarkable improvement was attributed to the quality of their periodic and pre-employment testing. Research has also shown that pre-employment testing reduced work-related musculoskeletal disorders, lost work days, employee turnover by more than 40%. So it is clear that it's a comprehensive, strategically designed investment in employees' health pays off. And Johnson & Johnson is an example of that. They also estimated that the pre-employment medical and other strategic workplace health programs have cumulatively saved the company more than 250 million. Okay, because they had those programs and they measure from it's part of what I'm going to be telling us on how to get the best out of our pre-employment program. Okay, because they measure they have some indicators that they measure, and part of the indicators that they measured was the amount of savings they were able to make from their wellness program, including the pre-employment screening, which was more than 250 million at that time. And then they also look at from 2002 to 2008, the return for every dollar spent on pre-employment and other wellness program was more than $2. So for every dollar spent on this wellness, employee wellness program, they had return of more than $2. That's like more than double in terms of returns. And then they were able to also save at least $18 for every $1 spent on pre-employment health screening. So this is to tell us empirically that pre-employment screening actually is something that is cost effective, and the company should not look at it as an expense item, but they should rather look at it as an investment item. Because from my own interaction and from my own experience with major business owners, companies, especially small businesses, you know, they always look at some of these things as nice to have rather than necessity or a necessary item to invest in. So let's look at the benefits that will accrue to companies, you know, that have committed to pre-employment screening. So apart from the cost saving benefits, there are other benefits that companies will get by investing in pre-employment, pre-placement, and periodic medical screening. The first thing is assessing employees' fitness. Okay, so before you engage any person, it is important to assess their fitness for the job. And it's important to assess that their fitness to the job, not just physically, but also psychologically and mentally. Okay, and this is important because it's going to help you reduce morbidity and mortality in some specific occupation by excluding unsuitable candidates. So it's important to assess the employee's fitness before they start any job. Very, very important. I mean, sometimes we've had stories of people starting a job and then maybe slump, they just slump in the factory or in the workplace. And sometimes maybe they came into that job or into that position or into that post with pre-existing medical conditions that were not detected before they started the job. So it's extremely important that we assess employees' fitness before they start the job. The second benefit is maintaining safety at the workplace. So new employees should be freed from medical conditions. The reason is because if you do not assess their state of health, there are some conditions that are communicable. We call them communicable diseases that can spread from one person to another. Okay, and it can endanger other colleagues if you do not detect such conditions on time. For example, TB. Okay, somebody may be having a TB and then coming to your workplace, especially where you have a big office where you have a lot of people working there, and you did not check pre-engagement whether that person had that condition or not, and the person came in, and of course, you could now start spreading that problem to other colleagues and even to your customers. Okay, so it's extremely important that for you to maintain safety at the workplace, you need to check the health status of your employees. Now, another benefit is health records, baseline, and ongoing data. So it's also good to have a baseline health information about your staff. Okay, so as they are coming in, there is a need to have a baseline health data with which an employee's future health status can be compared. You know, so if you have, as the person is coming in, you collect basic health information that will serve as a baseline in the sense that before they start working with you, you have all those information recorded, so that at the later time, maybe 1 year, 2 years down the line, you can check again to see whether anything has changed. And then you'll be able to compare whether the work that they are doing is having any impact on their health. Okay, so I mean, we've seen cases where some people will have something, develop a problem in the workplace, and then they will sue the company that they got the problem from the company. And if the company had not checked whether the person came in with the problem or not before they joined them, then it becomes a problem. So that is the reason why baseline healthcare information of staff or employee is extremely, extremely important. Okay, so as an HR expert, you must ensure that you have the baseline health information of all your employees. Very, very important. It will save the organization, especially if something happens later, down in later years, so you will be able to have something to fall back to. So the pre-employment health screening will help you in that regard. Another benefit of pre-employment, pre-placement, and periodic health check for employees is for you to be able to ascertain productivity and efficiency. A healthy employee generates healthy results. And I'm sure you know this. A healthy employee generates healthy results. So if you check their health status, you'll be able to detect problems on time, and you'll be able to address those problems, on time, so that before they deteriorate and start affecting them, and in turn affects their productivity, you will have addressed such problems. So it's extremely, extremely important. Another benefit of pre-employment, pre-placement, and periodic health check is that it will help you reduce your reimbursement expenses. So reduce expense reimbursement. An employee who suffers from a long-term illness, which may require frequent hospitalization and absenteeism from work, may cost the employer a lot of money. And we all know this. So if you're able to prevent quite a lot of problems, health problems, then you'll be able to save the company hospital expenses, and then the cost as a result of absenteeism. And sometimes even employees comes to work sick, okay, what we call presenteeism, okay? That one is even worse than absenteeism, because they are at work, but they are not at work at the same time. They are not really working, they are not effective. So most of these things will help prevent all this. Another benefit is it will improve the employee morale. When they are healthy, when you're able to detect health problems on time, and then you're able to see to their health status, their morale will improve. A lot of studies have shown this, and I'm sure you also know that. So often overlooked is the potential to strengthen an organizational culture and to build employees' pride, trust, and commitment. So the inherent nature of pre-employment screening and other wellness, workplace wellness program, requires a kind of partnership between employee and employer. And then this will, because personal health is such an intimate issue. So investment in health can create and deep bonds and improve staff morale. So when a staff, perceive that you really care about them, you really care about their health, it will improve their morale. So another benefit, number 7, is it saves life. So when you're able to identify a problem on time, you'll be able to address the problem, and you'll be able to save that person from a lot of morbidity and sometimes mortality. Morbidity in the sense that some of those problems will just become very bad, and then it will start weighing the person down, and mortality in terms of death. Okay, so it's very, very important for us as healthcare professionals, healthcare management experts, to pay attention to this. Okay, so the other benefit is it will help the organization to meet the work or labor legal requirements. And I'm going to talk about this later, because there are some laws that that mandates, so to say, employers to pay attention to some of these things, especially pre-employment, replacement, and other wellness programs for staff. So we're going to talk about some of those legal requirements later. So, but it's important that it's important for us to note that one of the benefits of conducting this is just for you to be able to be on the right side of the law. So it's quite important for us to do that. And then lastly, last but not the least benefits that I have here is that it helps you to achieve what we call person job fit for your organization, okay, to ensure that employees will be doing the work that is suitable and safe for them. Okay, suitable and safe for them. If you do not conduct, or we do not conduct, a pre-employment health screening, it will be difficult for us to be able to know whether the candidate is suitable for the job role that you are proposing for that person or not. Let me give you a very classic example. So for example, we have some conditions like asthma, okay? So if somebody is coming into an organization with asthma, there are certain places where you cannot put that person, especially maybe a place that is very dusty, because it will keep triggering the condition. Okay, so if you did not check ab initio that, okay, this person has some conditions that will not allow him to work in certain places, then you will be putting the life of that person at risk, and you will not achieve what we call person job fit. Okay, so these are the benefits. Now, much more actually, benefits of pre-employment, replacement, and periodic. And before I go on, when we say pre-employment, we are talking about health screening that you conduct before you even employ that person. That is this person even fit to work at all or not? That work for that role or not? Work in that organization or not? That's pre-employment. Pre-placement has to do with a specific place where you want to put this person. Is the person fit to work in that place? Because it is one thing for you to employ somebody into a factory, for example. Maybe that person will be able to work in the admin, but not be able to work in the factory because maybe the person has one condition or the other that will not allow or that will not permit that person to work in the main factory. So employment will help you screen whether the person is fit to work, and then pre-placement. Usually in practice, we normally just conduct these things. We just factor all these things together. So when we are conducting the exercise, we just factor whether the person is able to work, or then factor where the person is also going to be working specifically. Okay, and then you now talk about post-employment or periodic. That has to do with the ongoing. After the person has been employed, what are the things that you continue to do? You continue to check the health status of that person to be able to see that the person is still in good state of health. Okay, so that's just to clarify on some of the things I have in the topic. So let's move on. So we've talked about what exactly is pre-employment, replacement, and periodic. We've looked at the historical background, how it all started, okay, and when it started, when people started considering this program. And then we've looked at the benefits And then looking at the benefit, we also look at a case study of Johnson & Johnson, how they've been able to maximize the benefits of pre-employment screening. So, and then we've looked at the benefits globally. So the next thing I'm going to take us through now will be the legal framework. Okay, the legal perspective to pre-employment, because it is backed by law. Okay, there is an International Labour Organization convention that Nigeria is signatory to. Okay, so the federal government of Nigeria ratified International Labour Organization Convention number 155 on occupational safety, health, and working environment in 1994. And according to the article 17.3C of our 1999 Nigerian Constitution as well, as amended, the government ensures and protects all employees' health. So the government has that responsibility to ensure and protect all employees' health, their safety, and their welfare. And then we also have the National Industrial Court of Nigerian Heart, which also has some sections in it that has to do with employees' health and safety. Okay, so it's important for us as HR experts to know this. Okay, so again, the other legal backing for pre-employment screening is the Labour Act of 1974. So according to Section 8 of that Labour Act, medical examinations, so it's talking about medical examinations for staff. And it says that every worker who enters into a contract shall be medically examined by a registered medical practitioner at the expense of the employer. So it is clearly stated in that Labour Act of 1974 that every employer must examine every employee before they are engaged to start working. So according to that, all of us should know that anyway. Then lastly, in the 1979 International Commission on Occupational Health publication, the determination of fitness for a given job should be based on the assessment of the health of the workers and on a good knowledge of the job demands and of the work site. So that document is also binding on Nigeria, the International Commission on Occupational Health. And it's important for HR experts to know that it is mandatory to a large extent, and it is legally required for every employee to be screened and to be examined before they start work and then periodically as well. So that will take me to the next discussion, which is, what does pre-employment health screening entail? What does it entail? Okay, so what does it entail? So these are technical areas now that I will try to break down as much as possible. So when people talk about pre-employment screening, what exactly does it entail? So there are three major aspects of three major components of the pre-employment health screening. The first component has to do with the mental assessment, or the mental assessment or mental evaluation of the employee. Okay, so this is a new requirement from the employer of labor. And then we have, especially for employees in the aviation industry, banking industry, medical, healthcare industry. Those industries are very, very stressful, and you interface a lot with human beings, and then you have a lot of conflict with people, and that may really affect they may affect employees' mental health. So, and this is why they added this aspect of employee assessment, where we need to evaluate their psychological, their mental, and their emotional health. So this is one aspect of pre-employment or periodic assessment that is quite important. Another part of pre-employment screening is the physical examination. So this checks for physical deformities or injuries or motor function, how the musculoskeletal functioning of the employee, reflexes, and so on and so forth. And this is a requirement for employees that are engaged in very high intense physical activities or exercise. Okay, so it's very important for us to also note this. And then the last, which most of you are familiar with, is the biological assessment. And this has to do with the medical tests that include blood, where the blood, the urine, the stool of the employees are collected for assessment. And then the other tests, radiological assessment, eye test, hearing test, lung function test, and so on and so forth. Okay, so these are required to check whether there is any biological derangement or biological problem in that employee. So I will not bore you with the details as in each of the tests, because there are several tests involved. For example, when we take the blood, we want to look at the blood picture. We want to look at the blood level. Okay, does this person has enough blood? You know, because if you don't even have enough blood, which we can check with using the PCV test or HB test, then with little stress, that person can go down. Okay, so you want to check the blood picture. Is there any form of infection in that person? So that is also part of what we check using the blood. You want to check other tests like hepatitis B, you know, for some industry. I also need to state this, that tests will vary based on the industry. So there's no one size fits all package for all the industry. So we usually customize, you know, different packages for the different industries. So for example, if you are in the food handling or food processing industry, we have customized made pre-employment or periodic assessment for the employees there, compared to maybe aviation industry and so on and so forth. Or you have maybe a transport industry where, you know, eye tests, auditory tests, and also those ones will be very, very important. You know, so I need to tell you that this thing is not just one package for everyone. We normally customize, or we normally package or adjust depending on the industry concerned. Okay, so several tests: kidney function test, okay, lung function test to check the functioning of the lung, the functioning of the heart, the functioning of the kidneys. We normally take their stool to check whether there are worms or some infections may be there, and so on and so forth. So those are the basic things that we do when it comes to biological assessment. So several things. I will not want to bore you because there are several tests and it depends on the industry anyway. You know, blood sugar, lipid profile, even to checking their fat level, their sugar level, you know, their blood pressure, their genotype, you know, all those things are very, very, their blood group, all those things are very, very important. Now, before now, it used to be people normally had HIV, but these days, HIV test is not really mandatory, except for people maybe in the healthcare sector, employees in the healthcare sector. For most other sectors, HIV, in Nigeria, HIV test is no longer a precondition for employment, as it is now against the law to even want to conduct and use it as a condition for employment. It is against it. So other tests apart from the normal blood test, like I said, will be screening for drugs, screening for alcohol. We all know that these days a whole lot of people are on drugs, and that can also actually affect the performance and the work of those employees. So it's also part of some of the things that we check. Again, depending on the industry. And for some industry as well, they require a pregnancy test, for women to check whether they are pregnant or not and all of that. So there are quite a lot of tests depending on the industry. I mean, that's quite important for us to note. Okay, so we about this, just investment health screening and then periodic health screening. We've looked at the historical perspective. We've looked at the benefits, and then we are currently on what are the components. What does it entail? And we've said that it entails or it includes mental, psychological, and emotional assessment. It includes physical assessment and biological assessment. And those are things that I have generally talked about. Now, for you specifically, how can you get the best? How can you help your companies to get the best of this program? Okay, because you are there, okay, to maximize profits for your company anyway, while you are trying to also get the best from the staff, or help the company to get the best from the staff. So how can you make or get the best of pre-employment health screening? So there are three major advice I want to give us. Basically, I know for some of us, we have medical advisors for our companies. For most companies, they don't. So they just depend on maybe their HMOs to advise them, or their if they have retainership, maybe, but most people don't have in-house occupational health physician. Okay, so so most of the time it's just try and error kind of thing that they do. And if you are getting your advice, for most small businesses, they don't even have HMO anyway. So they just talk to a doctor or to anybody, and whatever they give them, they take. Or it's not all doctors that are experts in occupational health. It's also good for us to note that. Okay, so let me give us this four advice. Number one, to get the best of your pre-employment health screening or periodic health screening, as the case may be, you must have a detailed understanding of both the work and the relevant health conditions of the employee. Okay, so there must first be an assessment of the workplace to look at what are the hazards, what are the risks involved in risk for the employees working in that condition. Okay, it's extremely important we have this assessment done. Okay, so having done that, because if you don't do that, even if you do your pre-employment screening and you do not know what can pose a risk to your employees in the workplace, because you have not done a thorough assessment. So the person may come in with a clean sheet, and then at the end of the day, the work environment is not really compatible, it's not promoting the health of that employee. So it's important for us to have that detailed understanding of both the work that the person is coming to do, and not just the work that the person is coming to do, but relevant health conditions or health problems that can arise from doing that work. Very important for us to note that. Another important thing that you must do, or to get the best out of your pre-employment, is that you don't just go ahead and just start sending people for pre-employment screening. It's important for us to use an appropriate, well-constructed questionnaire that we first do a kind of what we call pre-assessment. Let me put it that way: pre-assessment assessment or evaluation, pre-assessment evaluation of the person. You know, so everything is not collecting blood, collecting urine. You know, what we call clerking in medicine. You know, so medical history of that person, occupational history of that person, and several other information that are important that will now help us to tailor the pre-employment or periodic or post or pre-placement, as the case may be, assessment as appropriate. Okay, so it's important for us to have that tool first, and most people don't do this. Okay, so I think it's something that you also have to take note of. And then you must establish that the proposed work involves hazardous task. Okay, now why am I saying this? It's just related to the first thing I said anyway, that you must have identified all the tasks, all the hazards and the risks associated with the work. Okay, so that is very, very important. And then you must establish that the safety and well-being of other employees and all clients are concerned. Of course, this will be of concern to every one of us. Okay, you want the safety of other employees and clients coming to your workplace. You want their safety as much as possible. So if you factor in all of this into your program, I'm sure you're going to get the best out of the program. I'm trying to make the presentation like 50 minutes so that we can have a lot of time for question and answer. So in the next 4 minutes, I'm going to summarize. We're going to look at some of the takeaways. You know, from this presentation. So number one takeaway is that pre-employment screening will not just save the life of your employees and clients, but it will also save your business or the business of your employer. Okay, so it's important for us to take note of this. So you are not just helping the employee, you are also helping yourself and you are helping the employer by, you know, investing in this program. Number two, you must understand the hazards associated with the industry, and especially the role you are bringing the employee to design a cost-effective pre-employment health screening package. So, you must understand the workplace, very, very important. If you can't do that on your own, which most likely you may not be able to do, you may need to engage the service of an expert in that regard, so that they can give you a report as to what are the risks or hazards associated with the workplace. Number three, make sure you measure key indicators to assess how your plan is really impacting the staff, clients, and the business as a whole. This will also inform relevant and appropriate intervention. So what we are saying here is that when you have this program in place, you must have some basic indicators that you want to measure before and after instituting some of these programs. So for example, we look at the Johnson & Johnson case. Some of the indicators they measured were cost they were able to save per employee, based as a result of their as a result of the program that they instituted. So it's important for you to also look at some of the indicators. Some of those indicators may even be absenteeism. What is the rate of absenteeism? What is the rate of presenteeism? How much were you able to save because of the program? How much were you and so on and so forth. So it's good to have such indicators so that your management will also be able to be convinced. They will see reasons why the investment is good and why they should do more, if need be. So it's good to approach it in that regard. So don't just do those programs. It's good to have data that you will measure to see whether the program is really working well for you or not. And this is not also because of that. It will also help you to, it will also inform relevant and appropriate interventions if need be. Okay, so if you are able to measure, you say, okay, this is not doing this, it's not doing that. So what else can we do? And then it will help you to do that. Now, before taking questions and answers, because I represent Sure Diagnostics, so I will just say a bit about our organization. Okay, Sure Diagnostics is a medical diagnosis center, and we have a mission to offer our clients cost-effective diagnostic programs. The difference between Sure and other diagnostic whatever is you can rely on us. You can rely on the results. The people behind it are people of integrity and high professional professional integrity. So you can take that to the bank. And another thing is you get all the support. So we don't just leave you. All the support that you need, you get it. It's a 360-degree engagement we normally have with our staff. So you get customer post-testing support, excellent customer post-testing support, affordable costs, robust medical advisory support, like I said, easy access to care and results, and so on and so forth. So I'm just using this opportunity to introduce Sure. Of course, we serve many companies, several companies, IHMS, Sheraton, Chi, Chicken Republic, Buka Hut. We serve several companies. So we also like to serve you. And I thank you so much for your attention. So I will leave the floor for questions and answers or comments. Once again, thank you for the opportunity. I hope you've been able to take one or two things that will help you improve your workplace wellness. Thank you so much.
Thank you so much, Dr. Adeyinka Adedina. We will pay for that advert. Okay, all right. Good evening again, ladies and gentlemen. If you have any questions, one, you can either type it or you raise up your hands, or you have any clarifications with respect to medical related issues. Some of the questions some of us like to ask on the group. This is your one-time offer to ask at no consultancy charge we apply. Okay. Do we have anybody who wants to ask questions? So I can quickly ask one or two questions, based on what people have generally asked me in the past. Doctor, is it really normal to, for example, to do pregnancy tests for a woman for just any job role? Is a woman obliged to maybe tell a prospective employer that I'm pregnant, irrespective of the kind of job, or notwithstanding the kind of job? Okay, and then we also have a question already on the chat. Please, let's keep the questions coming. Doctor, this question is coming from Daniel Akorede, the man who had the powers over lions. Okay, Sir, thank you so much. I would like to know if an employment can be determined by the outcome of pre-employment test. In other words, can you deny employment to somebody solely based on the fact that the person, so to speak, failed or did not pass a test? And I will also add a follow-up question. If you are going to deny employment to someone based on a medical outcome, ideally, ethically, are you supposed to disclose to the person, or are you supposed to handle that? I hope you are able to follow the 2-3 questions I've been able to put across with you. Dr. Adeyinka, you have the floor. Please, let's keep the questions coming quickly.
All right, so thank you so much for your questions. Pregnancy tests. So, see, that's a quite dicey one. So, like I said, it depends on the industry. So, for example, if you are coming into a radiology unit, okay, and we know that you are going to be dealing with some hazardous items that may be injurious to you or the pregnancy that you are, it will be stupid not to conduct a pregnancy test for that kind of fellow. Okay, so it's not, just like I said, it's not that you just conduct any test. You have to look at what exactly the person is coming to do, what you have to understand the work environment, and so on and so forth. So it's not just for the benefit of the organization, it's also for the benefit of the patient, of the employee. And it's important for us to know that. So again, it's also for some people that normally take help, okay, or caregivers or whatever. So there may be some work that are very, very stressful, and you don't want to engage a pregnant woman for that kind of job. So it will not be out of place not to conduct a pregnancy test in that regard. So again, it depends on the job you are bringing the person to take. Now, can we, the outcome of can we use the outcome of the examination to determine whether the person will have the job or not? Of course, that's the purpose. I mean, that's not the sole reason for pre-employment assessment. The major reason is you look at, okay, this person has this condition. Is this person fit enough to work in this organization first, based on the health status of that person? So if the person is not fit to work in that organization first, of course, the outcome of the assessment, we say that the person is not fit to work in that place. That will be the outcome. It's for the doctor to decide, having understood what the person is coming to do, the work environment, the hazard the person will be exposed to, and so on and so forth. So the outcome of the examination can determine that in that regard. But usually, even if the person cannot work in certain places in the organization, okay, the person should be able to work in the organization, but in another place. And that's where pre-placement will come in. Okay, so usually that's where we normally have issues, not that, okay, the person is outrightly denied, except the person is completely, how will I put it now, very sick and that cannot do the work at all. Okay, but if it is, okay, you check the person has TB, you can treat the TB, and the person comes back, and then you check again. The person has some lung function, whatever, is it as a result of infection, can you treat? The person has some infection or whatever, can you treat? And then the person will come back. Or the person has a condition that may not help the person to work in a particular role, but can still work in the organization, and so on and so forth. So those are the dynamics. So I mean, in summary, of course, the outcome in extreme cases can determine whether the person will get to work in that organization or not. Ethically, now, before you engage anybody to conduct any test, you have to seek their consent. So usually there is a consent form that HR people will normally give the employees to sign that I consent I consent to the fact that they can take my blood sample or my body sample, test it, and then they can disclose the result to that employee. You have to cover yourself in that sense, because if you don't take the sample, then that's not ethically right. I mean, that if you don't take the consent, that's not ethically correct. Okay, so it's good that we must take consent, and the employee must understand what you are trying to achieve, what you want to do. You must be very open. That is in their own interest, which I've showed you is largely in their own interest, actually. Okay, so we need to understand that.
Thank you so much, Dr. Adeniro. A rider to that same question, the very last question we responded to. So let's assume Mr. A, we have tested him, have done medical tests, and because of that medical test, we cannot take it. Should we call him and say, Mr. A, we are not employing you because you remember you did a battery of tests, maybe 8 or 9 tests. And 1 or 2 of the tests particularly, you didn't pass it. And because of the nature of our job and our organization, you will not be a fit. However, we suggest to you that you can maybe go ahead and seek treatment on your own. Should we just tell the person, we are not hiring you? Are we obligated, obliged, or is it reasonable to tell that person to go back to the hospital and seek treatment? Thank you, sir.
Okay. Okay. Now, thank you, sir. I mean, that's clearer now. Now, so if from our own experience, and I mean, we've been doing this for some organizations now. So when somebody comes and the person, we cannot certify that person fit to be taken for that employment. So for one reason or the other, so we normally suggest the solution that, okay, this person should undergo this treatment and this and this and this, and then maybe come back for a retest to be sure that this and this, after so period, and to be sure that, okay, this person is now cleared and so on and so forth. So the patient or the employee will know the reason why they are not cleared. Of course, they are entitled, is mandate, is ethically. How will I put it now? That is the get to inform the employee that this is the results of your test. These are the issues, because you cannot collect my sample, collect my body sample and whatever, and then I don't know anything about the results. Okay, and then you now start using that result against me. I mean, that will not be correct. So I believe, and we believe ethically, it's ethically right to call the employee, tell them that, okay, we have conducted this test and this test, and we have confirmed that these and these are the problems, and because of this and this and this and this. It's just like when you also do some, but the difference there is because this one is medical. You know, normally you also do some pre-employment assessment or background check on the employees before you take them, okay? And then when you find out that there is 1 or 2 or 3 things, and then you say you are not taking them. But for medical, I would believe that the employee must be informed of the outcome of the results, okay? And then whatever step they now want to take, they have to be properly guided. So we don't just leave them, even as a healthcare professional, we don't just leave them and say, oh, you have this. So for example, if there are those problems, you can write a letter that, okay, we don't provide that treatment here. We write there, blah, 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 we refer you to this place, and then let them further evaluate you and assess you. So it's not a short journey. It's something that will take a lot of time before you conclude that you will not take the person or you will take the person. And even if you are concluding that you are not taking the person because of the fact that the person does not fit medically with the job that you want that person to take, you still have to inform that person of the outcome. I hope that answers the question.
Absolutely. Thank you so much, sir. Some questions on the Zoom chat. Okay, so someone here is saying, are you saying that it is wrong for an employer to ask a candidate to bear the cost of the screening?
Wow. Legally, according to that Labor Act that I quoted, the employer should be the one to bear the cost of that screening. Okay, so legally it is not correct for you to say you want to employ somebody and then you now ask the person to go and conduct medical tests and bear the cost. I mean, legally it's not. So according to the law, backing pre-employment screening, the employer should bear the cost.
Okay, so, and that is why sometimes some organizations will say, since we bought the cost and we got the result, we are not obliged to share a result with the employee or potential employee.
Anyway, some organizations can do that and they will get the consent as long as you get the consent of the employee. Do you understand? That you can do that. So if you get the consent that we can have your result and we may not tell you the outcome of and the person signs to you, I mean, but ethically, I'm not sure that is the right thing to do.
Okay, thank you so much. We have Mr. Akorede raising his hands. If you can hear me, Mr. Akorede, you can ask your question.
Yeah, thank you very much, sir. Now, I just want to paint a clarity to the question I asked earlier. Okay, let me say I have a case at hand now whereby someone was sent for pre-employment examination. But in the long run, the person came back and gave us the result of positive. He was tested of hepatitis B. And he was trying to contest the result that he has his own personal hospital where he uses, and we asked him to go and get the same, we asked him to go and run the same test. So when he came back, he brought a negative test to us. So meaning the hospital we are using tested him positive, while the one is using tested him negative. So I want to know what can be done in such a situation.
Hello, Dr. Yinka.
Yeah, thank you so much, Mr. Akorede, for your question. And one of the reasons why you don't also allow employees to go and conduct their test and bring results to you is because of such things. Generally they want the job. They can do anything to get a clean result, okay? So it's better to get an independent person to examine the candidate. Now, again, of course, when you have a conflict of results like that, what you just need to do is to get another third opinion, and then that should clear the whatever. But I won't suggest or I won't advise that we allow the candidates to be the one to start bringing in results and say, oh, I am negative, I'm not this, I'm not that, I'm not this, I'm not that. Get a consent that an independent person will take your blood sample or your urine sample and they will test you. All you just need to do is to present yourself there. So once they test you, we have the result. And then if ethically, you should share the result with them anyway. But if they contest the result, okay, we can now say that, okay, let's get another independent person. Not that you will go and bring your own result from another place. And once you get another independent person, usually, most organizations, they have more than one vendors they are dealing with. So you get a repeat, and you say, okay, this is the confirmation. So, that should do at that point. So that would be my advice. So we should not let candidates be the one. We should not let them be the one going out to get tested and then start bringing results for us. And that's the reason why in that law, they said the employer must be the one to provide that service for the employee. Thank you.
Thank you so much, Dr. Adeniro. Another question here from Abiodun Olabi, and he says, since HIV test is not a basis for employment, can organizations still do it just to have the knowledge of their status?
Wow. Usually, personally, I normally recommend that they don't do it, especially if it is not relevant for your industry. Okay, so why do you want to know my status when it doesn't have any bearing to the work that I'm doing? Okay, maybe if, like in the presentation I told you, for some industry like healthcare industry, yes, it has bearing to the work. Okay, but maybe somebody is just coming to the office or is a food handler and whatever, it doesn't have any bearing to the work he's doing. So there's no point subjecting that person to a test that does not have bearing to the work. So just for knowing sake, no, we don't allow that. We don't just conduct a test. Ethically, it's not correct. Just for you to just know their status. So we don't encourage that at all.
Okay, there's one question on the chat, but before I ask, let me quickly also ask this question. Most organizations typically do a test for employees or potential employees before they join. At what frequency would you advise repeat tests or checks, medical tests for employees subsequently? Is it annually, every 3 years, or there's no need?
Thank you so much for that very beautiful question again. I mean, that's also a very good question. So it depends on the industry. So for example, for food handlers, it's every 6 months. For people in the banking or whatever, it's yearly that we say, okay, just do a periodic annual check. So it depends on the industry. So for some, it's every 6 months. For some, it's yearly.
Okay, thank you so much. So somebody here, okay, Mr. Adesina Martin says, our pre-employment test compulsory. He says he's aware some organizations do not even conduct the employment test at all. And also I can testify, I've worked in 1 or 2 places that we didn't even bother to test.
Yeah, like I said in the presentation, it's mandatory actually. I mean, there is a law backing pre-employment health screening for all employees in Nigeria. And I've stated that, but just like any other law that we have, the implementation and the enforcement is usually very poor. So the same thing with this, but by the time you get to a level, for small businesses, yeah, most people get away with it. But by the time they start noticing you, of course, they will now start bringing up all those issues, at one point or the other. So it's just for us to know that these things are there.
Thank you so much, Dr. Adeniro. More questions coming in. Before we take a voice question, I have a question here. I need your response both as a doctor and an employer of labor to answer this, and associate to HR. Abiodun Oladimeji says, Sam, in this era of urgent talent sourcing, in other words, trying to hire replacements for roles, when you have to fill up spaces that have been thrown up due to JAPA, he says that what are the basic tests that can be quickly taken not to delay productivity regardless of the industry?
That's also a very smart question. That's a very smart question from, an HR expert. Very, 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 very valid question. Because again, you don't just want to do tests on people. You have done a very comprehensive test, and after 3 or 6 months, they are gone, and then you now start recruiting again, and then you continue the cycle. We don't want to do that. So it's now looking at the basic test. It depends on the industry. So if I understand, so which industry are you looking at? Can you be a bit specific? Mr. Abiodun?
So while we wait for Mr. Abiodun, Adekoya Oluwakem is asking here that for food handlers, what are the basic food handlers investigation? Mr. Abiodun has also responded, engineering consultant, sir.
Engineering consultants. Okay, what exactly do they do? I'm trying to understand what, I know public health consultant, we know what we do. So engineering consultant. Okay, I don't know if Mr. Abiodun can just, if he can, we can do a voice, whatever. So I understand, because it depends on the industry. It depends on the industry. It depends on the work that the person will do. It depends, so you can't just like I
said architect, sir, architecture.
Okay, so structure,
like
architects,
those kind of things.
Okay. So again, I may not be able to give full details because I will have to understand what does the work entail, and so on and so forth. You know, I'm in a medical, so it's when I have that conversation that I can now say that, okay, do 1, 2, 3, instead of doing 10, just do this 5, you know, just to be able to be sure that everything is okay. And then maybe later you can do this and this and that. Okay, so that's just what I would say for that, because like I said in my presentation, you need to understand the hazards that are involved in the work. You need to understand that work environment. You need to understand what the person is coming to do, and so on and so forth, for you to be able to prescribe an appropriate package for that person. Now, what are the components of food handler screening? Okay, so basically, we have a wider test, which we check for typhoid. Usually, it's just a screening test. So even if it is positive, you still have to get a repeat to be sure that that person doesn't really have typhoid. You have hepatitis C, okay, which is a kind of hepatitis viral infection. You have stool analysis, which we check for over and so on and so forth. We have PCV, which we check for the blood level. We have urinalysis, which we also check for the kidney status. And then we have, so about 7 of them. TB, yeah, so we normally check for TB as well. So those are the basic tests. And of course, some people also normally add hepatitis B to it. In some other places, they add hepatitis A. Okay, so some people do A and B, and some people do B and C. So depending on the kind of people you're looking at. So those are the basic tests under food handler screening.
Okay, thank you, sir. Normally, we don't take people whose name is not clearly written, but I'll take a risk just one time. Mega Millions Nigeria, can you ask your questions, please? Meanwhile, doctor, you can drop in the chat box show diagnostics, contact details, phone numbers, those kind of details in the chat box. Mega Millions.
Okay.
Yeah,
okay, good
please,
evening.
Share the money. You know, we all need cash right now, and you have Mega.
Good evening, sir. My name is Uche. So, I thank you for this topic. Okay, for organizations that they've not done for staff, and somebody asked now, you know, just in the rush to fill spaces and people resumed and some have been working. And you talked about consent before carrying out a test. In a situation where somebody does not give consent to, you know, run the test, what should the HR do? Secondly, I know we have issues bordering around confidentiality and handling of, you know, reports. Definitely it will get to somebody between HR unit and the firm conducting the test. If there is a breach in confidentiality, what should HR do in that situation?
Sorry, before you go, in terms of the second question, when you say breach in confidentiality, what exactly do you mean?
Yeah, the result of the test comes and maybe is not okay. And of course, it's supposed to be treated confidentially between you and the firm and the staff, kind of. and maybe another employee gets to know
Okay.
about the results. Yes, that's what I mean.
Okay, great questions, actually. You try to take consent, the employee declined. What do you do? I mean, you have to decide what you want to do as a company. Okay, if you know this is mandatory and the person says, I'm not giving consent, then that means that person does not want to work. I mean, that's just the honest truth there. Of course, sometimes people don't give consent where they don't understand what you are trying to do. So it's also important sometimes to just direct them to the medical advisor or medical person that will explain what is being done, because when they know that this thing is to their benefit, much more than even to the benefit of the organization, I'm sure they will not decline. Okay, so maybe it depends on how we now engage them. But having done all and the person still says that I'm not interested, then of course, maybe that person is not interested in the job. So that would be my response to that. The second one, talking about confidentiality. Just like you said, confidentiality is very, very important. No other employee should have access to that result. So the result is usually from the laboratory manager directly to the HR in charge, okay? Normally by mail, okay? Then so that, and so when they get it by mail, it's not likely that it will get to another person. So sometimes the employee wants to have a copy, maybe a physical copy of that result. That will be left to the organization to decide whether they want to allow that or not. But usually the results should be directly from the lab to the HR person, manager in charge. And so if the result now gets to another person, then there is a compromise somewhere that the organization has to now look at in that system. I hope I have.
Yes, so let me just quickly add one or two things on HR perspective, Doctor. I want to support your response from HR perspective. When you are dealing with medical, so I need to say this for the benefit of our colleagues here. So if you have a team, an HR team that is more than one, in other words, maybe you are 2, 3, 4, or 5, depending on the size of the organization. Things like medical, let only one person handle it. Also, when, for example, if you are going to receive the medical report by email, don't let the medical report be sent to, let me give a company name. So let's say oluyemiandsons.com. You now have hr@oluyemiandsons.com. But that hr@oluyemiandsons.com is a group mail that 4 people have access to, or any email that drops defaults into email of 4 other people. We are already compromised. There is no way 4 people can be confidential, almost impossible. In that instance, so I've worked in a place where, for example, we had an email called medical@something.com. So only maybe the chief human resource officer and the specific HR person responsible for medical. So if there is any leakage, there's only 2 people we can hold. Now, there are instances too, for example, when HR is speaking with, say, a line manager, maybe there's a medical situation with the employee, and I've been involved in quite a number. We'll call the line manager. We'll say, dear line manager, we need to give your staff, say, extended leave for 3 weeks or 2 months. However, we will not tell you why. But we have confirmed that this is the reason, and that it's a medical reason and it is valid. And we will send a mail. Now, in some instances, because of the rapport the line manager will have developed with the employee, if it's someone that shows empathy and reasonable, that person may now tell the line manager himself or herself. We assure the employee, we are not telling nobody. If anybody knows, you spoke. So you also need to have that kind of framework to minimize leakage. Secondly, typically we have medical records. Maybe you got it via email and you printed it. or it was sent via hard copy. We don't also put medical record in employee file. We actually now have another file that is just medical records that is in a separate safe and not accessible. The reason is, somebody else may legitimately need the employee file for something. In the process, go and stumble on something they're not supposed to stumble on. So we need to, when you say confidentiality, is the mechanism you put in place that either supports it or that can. I hope that's been helpful. Ayola, I don't know if you are a man or woman, but please, you have the floor. Meanwhile, doctor, there are some questions on the chat box. You can just scroll. There is one from Lake.
Hello, good evening, sir. Good evening, sir.
Go ahead. Good evening.
Thank you very much for this wonderful presentation. It's very, very educative. Yes, I am so happy to join almost at the end of this presentation, but I'm happy that I joined during the question and answer. And I am faced with one issue in my place of work that concerns pre-employment, that's medical screening. When I joined the company, it happens that the medical screening that are being done on the prospective employee, the doctor does not give breakdown of the test. What the doctor does is he will just tell us that this person is fit for employment. And that is the way it has been done over time before I came in. So when I joined, I was like, it doesn't really sound well, you telling me that somebody is just fit for employment if I cannot have the breakdown of the test that was run on the person. I'm sure, urine tests, blood tests, and the likes. We did not see anything. It is only the employee is fit for work. So I reported that to my line manager, and my line manager said I should take it up and to discuss it with the doctor. But when I discussed the same issue with the doctor, this doctor felt kind of like as if I'm teaching him his job or something of sort. And he was like, it's not a professional for them to release such kind of information to us as HR. And I was like, we are the one that sent somebody to you for a screening. Then definitely we should also get the result that we asked for, not you telling us that the person is fit for work. So I just want to know if I am the one that is overdoing you, or maybe by profession, by HR ethics, maybe these are the things that are done, that are meant to be done, that I am not doing, or that is supposed to be done that I am doing. So I just want to know, please.
Beautiful. Thank you, Mr. Ayola, for that beautiful question. Very, very germane as well. Just like I said, maybe because you didn't really join my presentation, you were not there when I was doing the presentation. I said something, and I've also talked about that even during the question and answer time, that before you take any sample from anybody, or you send somebody to go and do anything, you must have the consent of that person. So once you have the consent of that person, that the result of this test that you are doing will be sent to the HR unit, and the person says, I agree, then the doctor does not have what the doctor needs is that consent form, that the patient has consented that his or her result can be shared with another person. Because if I don't see that as a doctor, I cannot share the result, even with my wife, or even if the patient is dead, I cannot share the result. The other person that can compel me to share the result, apart from the patient itself, is the court of law. Okay, those are just the two people that can compel a doctor to share patient's information with another person. Okay, so you HR people need to understand that So all you just need to do is the patient comes with a consent, or the candidate comes with a consent that I have consented that the detail of the result should be sent to this person. And they have assured me that it will be treated with utmost respect. Then the doctor will not have any other option but to share the results. So for example, at SURE, we get those consent form and we share the result with the different HR people that will need the result. I hope you understand me. So that's just from your HR perspective. Maybe Dr. Adeosun has a different experience on the other, but from the medical perspective, that is our own practice. I think I hope that answers your question.
Yes. Okay, Dr. Adeniro, we need to wrap up now. So let me just take 2 more questions from the group and then one final one from me that I prepared for you for today. So Lake here says, good evening, good presentation. What will be the situation of things if a female candidate or potential employee did not disclose that she's pregnant during the interview and she has already resumed before going for a medical test, which now shows that she is pregnant and also hepatitis B positive? Any possible way to handle it? Then let me add this other question too, sir. It's related to pregnancy. Good evening, sir. Can a pregnant staff who is about 3 months gone also partake in annual medical check? Hello, Dr. Yinka.
All right, thank you for those questions. If the work requires that the woman must be tested for pregnancy before they resume, don't allow them to resume before you test. I mean, that's what I'm going to say. So it's important, depending on the work. If you know that this work, you do not want somebody who is pregnant to be exposed to the work, then it's better to test. Not that you leave the person to start work and then after 3 months, you now discover that the person is pregnant, and then it will now be difficult to stop that person. Okay, so it will be more difficult. So that's the reason why it's important to take note of some of these things. But if the work does not require, it does not really, it does not have any bearing to do with pregnancy or so. So, I mean, there's no point stressing yourself. Most pre-employment and periodic medical examinations don't really have pregnancy tests in them. Okay, so because pregnancy is not a disease. Now, the person is now pregnant, but now later you now discover that the person has hepatitis B. So it's just for that person to go and see the doctor, and they will further evaluate and treat as appropriate. Now, the other question is, sorry, I didn't get the other question. Is it, can the pregnant woman?
Yes, a pregnant woman that is 3 months gone partake in annual medical check. Maybe you are doing annual medical check for staff, for example. Is it okay, safe?
Yeah, of course. Yes, it's safe. The only thing is for annual medical check that will involve X-ray, they will now have to delay that. Maybe they can do another test. So instead of doing radiological test, they can now do blood, TB, or alternative. But the doctor has to be informed or must be aware. Anyway, the doctor will even have to ensure that the person is, the pregnant woman is not subjected to radiological investigations.
Thank you so much, Dr. Adeyinka. You know, this is a very convenient spot, but because of your specialization as a public health physician, it will not be good if we don't give you a few minutes to just generally tell us, are there anything as HR professionals that we should be aware of, any new health, scare? What do you call it now? You know, back then we had Ebola, then we had the COVID-19. Any new thing out there, or any old thing that is reoccurring?
Currently, there is a scare of diphtheria. So we've been having cases of diphtheria recently, I can't remember the number now, but quite a lot of people are dying from diphtheria. There is an outbreak of diphtheria now. Diphtheria is a bacterial infection. It is vaccine preventable. It's common among children under 5. Okay, so it's not really an adult thing anyway. So apart from that, I'm not sure there is any other thing that is like a scare, except all the issues that we are facing generally. Wise. So it's just for you guys to know that we have that. So encourage, especially nursing mothers, to make sure that they complete the immunization schedule for their kids. So diphtheria is one of the vaccines they must take. So let's just ensure that we also pass across that information. So for now, that is the only thing coming to my mind. I don't know if you have anything in mind specifically.
Not at all. Not at all. Can we have your closing remarks, please? Thank you so much, Dr. Adegbu.
All right. So thank you, guys. Thank you so much for the opportunity. Thank you so much, Mr. Yemi Adeosun, for inviting me. I hope this is useful. And I will be expecting business from you guys. We've dropped our website. Please check us up. And then the number is also there. Somebody is going to attend to you. I can assure you, just give us a try. We will not disappoint you. Every of your medical advisory, you can be rest assured that Sure Diagnostic will take care of it. So thank you all. God bless you. Have a wonderful week ahead.
Thank you so much. One more favor, Dr. Inka. Help me type the name of that immunization in the chat box. Somebody is asking. Tino Ade is asking that what is the immunization, but don't say it, type it, so that at least it will be clear. All right, ladies and gentlemen, it has been a wonderful night of learning and also engaging with one another. Please watch out for more episodes as they unfold in the days and weeks ahead. Please ensure you have a productive week. All right, and if you need cash, don't worry, you will soon get it. All right, if you need fuel, also don't worry, you will soon get it. I have a song for you, okay, that no matter what you are going through, don't worry, be happy. All right, bye everyone.